My name is Dr. Sara, and I'm a naturopathic doctor. I have special training in oncology in integrative oncology. I studied with Dr. Nasha Winters and learned about the metabolic approach to treating cancer with Dr. Guillory, who is the owner of RootCauses Medicine in San Antonio, Texas. That's the clinic that I work at with patients using Heads Up Health. And my role there is to review patients' labs, whether it's blood work, urinalysis, functional medicine, and look at their progress as we treat them and improve their health.
Seth Garcia, Executive Assistant for Dr. Derek Guillory, and I also assist Dr. Sara. And there's a lot of patients, and we try to keep track of all of them and monitor their labs and get plans for them so they can have healing on their journey.
So typically when a patient starts with us, we do a lot of onboarding labs. That's going to include blood work from potentially Quest, LabCorp, Ulta, or anywhere that the patient wants to go. Sometimes they're using someone like Avexia. Typically, we're doing a lot more than the comprehensive metabolic panel and the CBC, which is what a lot of doctors are doing to monitor their oncology patients. But we do a lot more in-depth looking at all of their nutrient values, whether it's immune-related vitamins like vitamin A, vitamin D levels, which are really trying to optimize zinc, selenium, B12, homocysteine. So a lot of those functional markers, but we're also looking at blood coagulation studies because in oncology, there is going to be side effects from treatments as well as more coagulation. We will look at vascular endothelial growth factor, D-dimer fibrinogen, usually about every 6 weeks. So we really want to be able to look at those and compare. Sometimes we're going to be looking at viral titers to cytomegalovirus, Epstein-Barr, herpes viruses that are helping to suppress the patient's immune system. Often we're going to be looking at thyroid. We do a lot more detailed work with things like lactate dehydrogenase isoenzymes and alkaline phosphatase isoenzymes so that we can look for markers of trouble before there's really a problem. So I'd say we do quite a bit more in-depth blood work, and it's individualized to the patient and their history, so there might be more. In terms of the functional work that we do, certainly we do a lot of the Dutch complete testing because so many cancers are hormone or estrogen dependent. And so we really use that and can also improve quality of life when we're helping to support people's adrenals with the cortisol side of it. Sometimes we'll even run a ZRT neurotransmitter panel, but a lot more we're focusing on improving energy. And energy and toxins have a big connection. So does oncology and toxins. So we do a lot of assessment at the beginning of mold toxins, whether we're using a urine mycotoxin test or a blood test. We also run a lot of heavy metals urine analyses. We also do the Vibrant Environmental Wellness Panel. We used to use the Mosaic or Great Plains Labs panels as well. Sometimes we're changing that up. We'll do a urine halide test from doctor's data, and sometimes we're doing the organic acids test, and it goes on from there. So before using Heads Up Health, patients didn't have access to their lab information except if they logged into their portal and looked at a PDF, which might be 10 to 20 pages. And it was very difficult for them to see their progress or to compare their labs over time. And most of these patients are working with us for a long time, fortunately, because they do really well when we take a really whole person approach to their health. So now the patients always have real-time access to their labs because they're connected to Heads Up through their email and password. If we make a change, they can see it right away. And that's nice because when we add new data, they have that, they can review it with their other doctors, with their family members, and they have a better understanding of how they're doing.
Dr. Sara and we had a spreadsheet that we would update in Google Sheets, Google Drive, and very time consuming. Labs would come in and I would put them in there. If I didn't, then Dr. Sara would do it, but somehow they would all get in there and it would show all their labs month by month. Kind of looks a lot like Heads Up Health a little bit. Heads Up Health is better because it has different categories, right, Dr. Sarah? I like it. It's
And it
nice.
automatically will give us a color value if the lab is high risk or low risk, which we
We
had
had
to
to
do
do the
manually.
color ourselves
We had to
before.
do that all ourselves.
We would just not even do it then. We used to put H's and L's in there, remember?
For
In the
high and low at the beginning, yeah.
And that kind of faded away, but it
And
was
it
very,
wasn't private, right? So we had to be really careful about if a patient wanted to see their spreadsheet, we had to be very careful about copying and sharing that information. And it was really subject to a lot of human error,
yeah.
just
That's
typing in the wrong number in the wrong column or accidentally pressing erase and erasing everything you just worked on.
before Heads Up Health. If somebody had just a couple of pages of labs, to put into their spreadsheet, it could take 15 minutes, 20, and now I just use the easy button and concierge, whatever you want to call it. But I just put it in there, and the next day it's already in Heads Up Health. So there's really no way you can compare that. I mean, if you add up all the patients, 15 minutes, 15 minutes, 15 minutes, 15 minutes for me, that's like a whole day's worth. I mean, I used to work on the weekends to put all these labs in. Now I just kind of use the weekends to catch up to make sure I'm not missing one of these patients' labs.
And what about when a patient would come to us and they would send us a package with 5 years of blood work? How long did that used to take you to enter in?
All day.
Days.
Yeah.
And now it's a lot faster. And we may not use all of their data, but it takes a few minutes to see chronologically over years how they've been doing. So for patients who really want to take a bigger scale look at their drivers of their cancer or how their chemotherapy has affected their bone marrow, or even just their absorption, they can see a lot of that over time when they look at the trends. App. That was what I heard a lot of is just, oh, I have to have another login, another app. But this is one is nice because it doesn't have to be an app. They can just use the web browser to log in. And they're often logging in. They'll say, oh, yeah, I'm in there all the time, which is really, really great to hear because it means they are actually using it. It's not just something we're using. And quite often now, a patient will say, oh, can you send my labs to this doctor? And instead of us having to send just the most recent 7-page PDF, I usually say to them, would you like me to send them the entire year in a PDF so that they can actually see how we're progressing? And that's really lovely to be able to generate that report in seconds, save it as a PDF, put it into their portal, which is secure, and then they have access to it and they can share it however they like. Sifting through PDFs is really hard because, especially if it's not blood work that we do, doctors don't often repeat the same blood work. But when you have it in columns, like for example, today, I was comparing someone who does blood work every 2 weeks, so quite a lot of data. And I had to compare the larger panel from June to the larger panel in September. So with Heads Up Health, just by minimizing the screen and scrolling over a little bit, I can choose what I want to compare. I can reduce columns. I can control what I'm looking at better in Heads Up Health, and it's all on one screen. So it saves a ton of time for me to find that. And then in my visits, I can also explain to patients how they can look at the table or the trend and see how much better they're doing. Or if something has happened and they're not improving, then we can talk about what happened from this date to this date and why is that worse. And so it really allows us to hone in on behavioral change, adherence and compliance to their plan, as well as little things that take them by surprise that they wouldn't have expected to change their health. It's actually amazing to be able to have that kind of conversation with people where you can say to them, what happened between June and July? Were you taking this? And they might say, yeah, I had one patient, for example, who accidentally purchased a different vitamin D product and went extraordinarily high on the vitamin D level because she continued to take the same amount of vitamin D and didn't even realize that she was overdosing on vitamin D just because she bought a different product. But when you have something like the Dutch test, because you're looking at all of these different hormones, whether it's adrenal or the estrogen and the estrogen metabolite, it's very inconvenient to have two PDFs side by side and try to get to the right page and share your screen with the patient. Whereas when you're using Heads Up, you could just place the columns and the numbers side by side, and it's so much easier to show them, say, a year apart or 3 months apart, how they've improved their estrogen metabolism or they've improved their adrenal function. So to take something that previously was visual or chart and put it in a chart, but then comparing one to the other, which Precision doesn't do for you if you do a repeat test, is amazing. Patients are definitely using the ketone tile in the dashboard with their ketone measurements. So that's really great and helpful. I definitely say inflammatory markers are really valuable. The ESR, and we tend to use the high sensitivity C-reactive protein because when inflammation is up, you really can't respond as well to any of your treatment. And then the CBC is always important because that's going to talk to us about bone marrow and bone marrow production of the white blood cells. Red blood cells carry our oxygen, right? So we're obviously trying to improve hemoglobin and red blood cells all the time and see that we have the steady number of platelets. The D-dimer isn't always a huge factor, but certainly some people do have those coagulopathies, and after COVID infections, sometimes after COVID injections, we're seeing the D-dimer and the fibrinogen go up. So it's nice to be able to address that in real time and do something to prevent those clots. In later stage of oncology, the D-dimer might be a little more important. The lactate dehydrogenase isoenzymes, they're not specific to oncology, but they do give us some markers of what's happening in the body that can be good or bad. Certainly patients like to be able to see their tumor markers, and they like to be able to see the carbohydrate antigen going down. We try not to put as much focus on the tumor markers because we know that they can change from other things. But I think for patients, that's really valuable. And patients also tell me quite often, you know, my mom has thyroid disease. So it's really valuable that we're tracking my thyroid. Has it helped in an outcome? Well, certainly in terms of our approach, because we're an integrative clinic and we use a lot of different therapies. For example, if we're using mistletoe, you're going to want to make sure that a patient has really great levels of vitamin D and vitamin A. And so what we did in the summertime was we printed up a spreadsheet about everyone's vitamin A and D. We captured everyone who was lower than a certain point and sent them all an email saying, this is the new dose that you individually should take, and we're going to be retesting in 6 weeks because your therapies aren't going to work as well if you're deficient in those nutrients. So that was really fun to be able to do that and just to be able to pinpoint who was low. So we have some plans to do things like that for inflammation, and then maybe send out a little e-blast or do a bit of an Instagram post and say, you know, here's why you should care if your inflammation is elevated. And then we can send a little notification to those patients that maybe this month their inflammation was a little bit higher, which is all going to be private for them in their portal, but we can keep tabs on patients better, and so the patients feel like we're really paying attention and we really care about getting their health optimized, not just doing the status quo.